I want to talk about Dale Bredesen. He's a brilliant physician. He was the author of The End of Alzheimer's, published in 2014. He has evolved that book and that compendium of knowledge, which he assembled, to create an entire program around the management of dementia, mild cognitive impairment, and later stage dementias as well. So this protocol allows you to, using a series of laboratory evaluations and MRI, to make an assessment of somebody's risk of dementia, currently where they stand in their intellectual functioning, and then to provide mechanisms for management and treatment of any of the deficits you might have that would allow you to maintain cognition and to be functional in your environment for much longer. So in the Bredesen protocols, we'd get an MRI of your brain to look for atrophy in certain areas that is really one of the first signals that you see of dementia. We do intellectual function testing to see if you have any deficits in terms of your intellectual functioning, and go back to look at the genetics. All of this information is assembled into an algorithm, and you're actually plotted out on the 5 recognized forms of dementia with specific recommendations on how you might manage that piece to prevent dementia as time goes along. So when I began to study for this course, which was really a review of a lot of the functional medicine that I studied, I began to understand what we actually could do to reverse dementias. And a major element of this is hyperbaric oxygen therapy. In many of the dementias, aside from just Alzheimer's, it is the failure of mitochondria. That's the powerhouse of the cell where energy is made, and it requires oxygen. If there is a failure of oxygen delivery to these tissues, they will not have the energy that they need to perform. It's particularly evident in the brain. It is such a fine mechanism to be able to recall a thought, to create a thought, to be creative in general. So this is where this is experienced first. The summation of a lot of metabolic issues will lead to mitochondrial dysfunction. But one of the main things mitochondria need is oxygen. If we use hyperbaric oxygen, we can dissolve up to 300 times more oxygen within the water that's in your blood and deliver that to the tissues. So when mitochondria get that much more oxygen, they produce that much more energy. The energy is useful to do cellular processes like taking out the trash. And this makes your neurons function better. This makes your brain function better. These are one of the common causes of, we would say, Lewy body dementia, Parkinson's, multiple sclerosis. These are all issues in failure of the brain at some level. We know that hyperbaric oxygen therapy decreases cerebral inflammation. So that would address something like MS. We know that it increases oxygenation. That would address something like Lewy body dementia. We know that these therapies are beneficial in the management of dementias, and we have that available here at the clinic, as well as full evaluation along Bredesen protocols to see where you might fall in terms of mild cognitive impairment, or even just making a decision about what your risks are for dementia. And should you be having any interventions at this point in time? Many of us have family members, we're caring for relatives with dementia, or feel ourselves might be slipping. Why did I just walk into this room? This happens often enough. So the evaluations we look at are, what are your risk factors? What are your baseline? How do we manage those things? Those are all available here at the clinic. With some of the modalities we use, including hyperbaric oxygen, IV therapies, and diet, exercise recommendations, we are focused on your cognition.